Blood flow restriction therapy is a relatively new therapy that's also referred to as BFR. This works by using something that's very similar to a tourniquet or a blood pressure cuff that's inflated around the affected extremity using a small handheld pump. The idea is that this limits the blood flow to that extremity or the amount that can come back from the extremity, which puts more force on those muscles without putting as much energy across them. That allows us to use this in patients that are either recovering from surgery or have had recent injuries where we can't put normal forces across their joint. And through putting less loads that don't damage the joint, we can still get significant improvements in their overall muscle strength.
What this means for an injured patient or an injured athlete is that we can start exercising you, mitigate muscle loss, help maintain your strength so that as your tissues heal, we are able to get you back to your sport a little bit sooner and offset some of the muscle loss that we typically see after injury or surgery.
This technology has been used historically in veterans as they're recovering from war-related injuries where they may have had fractures or other issues where putting excessive force on the joints would have caused them to have further harm. By protecting their joints, this allowed them to do less work but get the same results as if they were pushing harder. This is something that we now use in patients that are either struggling with recovery from surgery or from non-operative management to help get them further along than they would otherwise without this treatment. Similarly, we feel like this can be used for patients immediately after surgery to try to accelerate their recovery, get their muscle strength back faster, and try to avoid things like quadriceps atrophy, which can happen after ACL tears or knee replacements.